3 new cases overnight. 14 of them are linked. They are mostly household contacts of existing cases. 9 remain under investigation. 11 of today's cases were in quarantine during their entire infectious period. Another 11 were in the community for some of their infectious period. Now, the lockdown and the significantly reduced interaction between people helps reduce the risk that those people pose. We have 13 people now in hospital with COVID, 4 in intensive care. None of the people in hospital with the virus at the moment are fully vaccinated. Yesterday, testing lifted to 3,763. So as always, please get tested if you have any COVID symptoms. Our testing centres have relatively short waiting times at the moment and are distributed well across the ACT. Yesterday, we announced some changes in the public health directions that come into effect at 5 o'clock on Thursday afternoon. There are a number of frequently asked questions that come from those announcements yesterday, so I hope I can address some of them now. Non-organised recreational activity includes things like walking, jogging, cycling, and going for a picnic in the park. It does not include organised boot camps, sporting competitions, organised team training, golf, tennis, those sorts of more organised sporting activities. Informal, small groups and conducted within your household or no more than 5 people. The reason for 5 people, that could be 5 people from 5 separate households, is to give singles and couples some opportunity to interact with others. But this needs to be done outside, wearing masks and for up to 2 hours. And the advice for everyone is that outside of these interactions, keep as far away from other people as you possibly can all of the time. The purpose of a lockdown is to reduce the interactions between people. So when you're outside of your home, outside of your household bubble, keep as far away from other people as possible. Have your mask on. All of this helps to reduce the risk of the virus transmitting between people. Now, one of the other risk points has been business activity, and our COVID-19 business compliance teams were incredibly active yesterday right across Canberra. Nearly 100 businesses were visited, and around a third were found to be not complying with the public health directions. The overwhelming issue was staff not wearing masks properly or not wearing them at all. Wearing a mask is critical. It reduces the risk of you spreading the virus. And what we're seeing in our daily numbers is a small number of cases each day who are people who've been working whilst they are infectious. I don't know they're infectious, but they've been at work infectious. And that's how the virus is transmitting, outside of the household and close contacts. So if you're not wearing a mask properly, it increases the risk of you transmitting the virus to a work colleague. ACT Police, Access Canberra and WorkSafe ACT are going to be active in the next 2 weeks to ensure compliance with public health directions, with a particular eye on people wearing masks in workplace settings. You need to do it. It's absolutely essential to keeping your businesses operating safely and to protect the community. And I want to thank the hard-working staff across ACT Policing, Access Canberra, WorkSafe ACT, the Emergency Services Agency, for all of the incredibly hard work that they are doing to protect our community. These are not easy roles, but they're doing a fantastic job to protect all of us. So please wear a mask when you are at work. Turning to vaccinations. Yesterday, the Prime Minister announced 500,000 additional doses of Pfizer as part of a vaccine swap with Singapore. He also announced that these vaccines will be distributed on a per capita basis around Australia. So we have been advised that the ACT will receive 8,344 vaccines. To put this in perspective, this is roughly the equivalent of a big single day of vaccination in the ACT across all our government clinics, GPs and pharmacies. Every little bit helps though. So this extra 8,344 will allow us to get through another day's vaccination more quickly. Today, bookings opened for 16 to 29-year-olds to access Pfizer vaccines at ACT government clinics. Already, to about 11:30 this morning, 6,500 new appointments and bookings have been made, which is great. If you're waiting for Pfizer, please register with the My Digital Health Record system and book your vaccination as soon as possible. We acknowledge, though, that the demand is incredibly high and we are making bookings now in November. So as always, the AstraZeneca vaccine is more readily available now through GPs and pharmacies. Being vaccinated is the best way that you can avoid serious illness and hospitalisation. Yesterday, as part of the business support packages that we announced, we indicated that we would be undertaking some further work on commercial and residential tenancies. ACT Cabinet met yesterday to put in place support measures for commercial and residential tenancies that have been financially impacted by the current lockdown. So this is tenants in both commercial property and residential tenants. This afternoon we will sign off on the commercial leases declaration and the residential tenancies declaration to provide greater protection for tenants impacted by COVID-19. To support the commercial tenancies declaration, we have reappointed a COVID-19 local business commissioner and will provide funding to facilitate professional mediation services between landlords and tenants to undertake good faith negotiations. Further information on government tax incentives tied to reductions in rent for commercial and residential tenants through rates and land tax schemes similar to those implemented last year will be announced in the coming days. In summary, 23 new cases, 14 of them linked, mostly household contacts, 9 still under investigation, at least 11 of the 23 infectious in the community for part of this time, 13 hospitalised, and 4 in intensive care. And once again, we thank the staff of the intensive care unit at Canberra Hospital for the wonderful care that they are providing those people. I'll now invite the Deputy Chief Health Officer, Dr Johnson, to provide a further update on cases and epidemiology, and then Chief Police Officer Neil Gagan will provide an update, and we will be available for questions together with the Minister for Health, Rachel Stephen-Smith. Thank you.
Good morning. I'm Dr Vanessa Johnston, the ACT Deputy Chief Health Officer. So, as the Chief Minister has just said, since our update yesterday, the ACT has recorded 23 new COVID-19 cases. Our total cases for this outbreak now stands at 297. The good news is that a total of 41 of our cases for this outbreak have now recovered. So that's 9 more from yesterday. So this leaves 256 current active cases. Of the new cases today, I can confirm that out of the 23, 14 can be linked to known cases or ongoing clusters. And out of those 14, we know that 13 are either household contacts or close social contacts, and the remaining 1 is linked to a known cluster. 9 are still under early investigation. Out of the 23, 11 were in quarantine during the whole infectious period. Of the 12 remaining, 11 of these were infectious in the community for at least part of their infectious period, and 1 is still under assessment. Since our last update, we have had just over 1,100 self-identified close contacts and over 3,900 casual contacts. So these people are still in quarantine. We continue to have over 200 current exposure locations dispersed right across Canberra. We're receiving a lot of questions about dates and times for exposure locations. These will continue to change as we interview and re-interview people and we receive more clarity about people's movements at these locations. It may also be that several people have visited the same site at various times and dates, and so the timeframes are updated continuously to match the total exposure time. So please continue to keep up to date with the current exposure locations on the ACT COVID-19 website. And if you've been to any of the identified locations, please follow the relevant public health advice. As always, if you have any symptoms at all, please get tested. Our wait times across our testing centres have significantly reduced in recent days. So in regards to Ansley Village, I'd like to give you an update on that cluster. I can confirm that in the last 24 hours, there have been no new cases linked to the cluster, which is also very good news. Our multi-agency team, together with our community partners, have and will continue to work and communicate directly with those affected and remain on site to provide all of those wraparound supports and care. In regards to the case mentioned by Dr. Common yesterday that we had not been able to contact yesterday, I can confirm that the individual has been located. They were located at their place of residence at Ansley Village yesterday. And our tracing teams are now undertaking interviewing processes with this case. The two active cases at Ansley Village have been relocated to our ACT government-managed quarantine facility. So there doesn't remain any cases, known cases, on site at Ansley Village at this time. To provide you some analysis of the broader outbreak, 34% of our cases are in people aged 0 to 17 years, 51% in the group aged 18 to 44, 13% are aged between 45 and 64 years, and 3% are aged over 65. So these proportions are largely unchanged or very unchanged from yesterday. We continue to have 12 confirmed public sites of transmission. Overnight, the following new cases have been linked to some of these transmission sites. So we have 5 new cases that can be linked to Bright Bees Early Learning Centre, so these are all household contacts. 3 new cases linked to the Murchie Indian Restaurant, household contacts again, and again 2 new cases linked to Lynham High School, also household contacts. In terms of our hospitalisation numbers and data, as of this morning, 13 people remain in our hospitals, 4 in ICU and 1 who remains ventilated. 12 of these are unvaccinated and 1 has received 1 dose of vaccine. At this stage, we know that 9 of the 13 that are currently in hospital have various pre-existing conditions. Of the 13, the youngest is 18 years and the oldest is 54. The vast majority, close to 70%, are in the 18 to 44 year age group. And here I'm talking about the 13 hospitalised cases, and the remaining approximately 30% are in the 45 to 64 year age group. So as Dr. Coleman mentioned yesterday, what we are doing is working. It remains difficult and challenging work, but it's working. We just need to do it for a little longer. This includes getting tested at the mildest of symptoms, or if you're directed to do it, by public health advice. Always use your Check in Canberra app, as this is proving so important to our contact tracing teams. Thank you for doing the right thing. And thank you to all of the teams that are helping to assist the community in doing the right thing. Today, my shout out goes to the amazing healthcare professionals who have been conducting in-reach testing in some of these high-risk settings, these vulnerable settings we've talked about, and providing the care and support that these residents need to help abide by the public health directions. They continue to do this with care and compassion day in and day out, and they're working extraordinarily hard over extraordinary hours, and I really want to thank them. Thank you.
Good afternoon, everyone. Neil Gagan, Chief Police Officer for the ACT. Firstly, I'd like to thank Canberrans for their efforts over the past 3 weeks. Overwhelmingly, most Canberrans are doing the right thing. So, on behalf of ACT Policing, thank you very much. It makes our job so much easier. I just want to provide a bit of an update in relation to the amount of people who I've spoken to over the last few weeks. So, since the lockdown, ACT Policing has done in excess of 3,000 home, hotel and business compliance checks. We've done over 11,000 traffic stops, primarily using our anytime, anywhere approach, as well as doing border checks primarily to the north of Canberra and to the east. Unfortunately, we have a small number that have done the wrong thing. We have issued 26 infringements. Those mainly relate to people failing to wear face masks or for non-essential travel. 20 people have been charged with failing to adhere to health directions, and the vast majority of those were as a result of being charged for more serious crimes such as stealing motor vehicles, property theft and criminal damage. I just want to quickly turn to the protest activity yesterday and provide an update. There were 2 small protests in Canberra yesterday, one at Government House in Yarralumla and the other one at Parliament House in Parkes. In total, about 20 people attended those 2 protests. The reason for the protests were primarily anti-vaccination and anti-lockdown agenda. 3 people were arrested by ACT Policing for breaching the health directions. 2 vehicles were directed to leave the territory, and further infringements are expected to be issued to a number of people who were in those motor vehicles. Unfortunately, we expect in coming weeks for those type of protests to continue. ACT Policing, with its partners, is well placed to respond where and when those protests takes place. Now, you've already heard from the Chief Minister in relation to the importance of wearing face masks. I just want to reinforce that. Over the next couple of weeks, the wearing of face masks will be the primary focus of ACT Policing and our partners. We've got to do the right thing. We're asking the Canberra community to continue to do the right thing and to stick to the health directions for the safety of the whole community. And with that, I'll hand back to the Chief Minister.
Thank you very much, Neil, and we're happy to take questions.
Chief Minister,
with you, Harry.
Chief Minister, as you've acknowledged, there's already possibly some confusion about the new rules coming into effect. Do you concede that there's increased risk with these new rules, and are you satisfied with that level of risk?
Well, any interaction between people has some risk. Where the changes that were put in place to commence on Thursday have focused are on the areas of least risk. This has been something that we've been grappling with throughout, that if you wanted to absolutely kill this pandemic stone dead, no one would have any interaction with any other person, and if you did that for about a month, you'd stamp out the virus. But that is just obviously not practical, because people live in families and live in households together, and as we have seen a lot of the transmission in our outbreak is someone gets infected and then brings it home and infects every unvaccinated person in their household. Or the other major cause is someone is infectious at work and infects their work colleagues. So they are the two really big risk areas. What we've not been seeing, I don't think there's any examples, even in New South Wales, of people walking around outside in a park, nowhere near anyone else, infecting someone. So my advice to everyone is stay as far away from other people as you possibly can. That's the best way that you can guarantee you won't get infected, or if you happen to be carrying the virus unbeknownst to you, that you won't infect other people. So in everything that you do, the chances that you'll either get infected or transmit the virus to someone else is based on how much time and how often you are in close contact with other people. Now, of course, in a family, in a household, there's going to be circumstances where you're going to be in the same space. That's where the transmission's occurring. That's what we're seeing.
Is it that outdoor factor, and that's how you reconcile the two between wanting people to stay at home, but also now being able to meet up to 5 people in a group? Yes,
that's right. I mean, we've got to balance mental health issues. We've got to balance people's ability to get some decent exercise and outdoor activity. We're coming into spring. People do want to have some social interaction with others. That's why you can't, just wrap everyone in cotton wool and never have anyone come into contact with anyone else. That's not feasible. So you've then got to look at, well, what are the least risk opportunities? And if there's mask wearing, it's outdoors and it's small groups of people and you stay away from other people, then the risk is pretty low.
Just on the AIS mass vaccination hub opening on Friday, how long do you expect the clinic to run there? And we've heard that it can process up to 24,000 vaccines a week. Could this capacity be increased if supply ramps up?
Don't think there's any forecast supply that sees us going beyond the capacity there, plus the airport clinic, plus GP and pharmacy. I don't think there's any. I mean, we'd start to run out of people then. We're looking to be able to vaccinate twice around 375,000 people aged 12 and above. Some of the vaccination will occur in reach, as has been the case with aged care and otherwise. So I don't think the AIS Arena will need to expand beyond the 24,000 doses a week. And that's likely to be the supply that we'll be able to get, because when, for example, more vaccines come, and Moderna is an example, that's going to be going through pharmacies, not through our hubs, is our understanding at this point. How long will the AIS Arena continue? Well, look, as long as people want to keep getting vaccinated, we want to keep on vaccinating people.
And just on that, is the ACT government paying the federal government rent for using the AIS?
Oh, look, I believe there's a commercial arrangement in place there. It is their asset. They generally charge us to use anything. We pay rent on Canberra Stadium, so I suspect that's the same.
Chief Minister, given that we are not predicted to reach that 80% vaccination target until mid-November, add 3 weeks is what you're talking about for the efficacy rate, are you able to give any certainty to larger events that they will not go ahead before Christmas? We've seen some confusion about what events should and shouldn't be cancelled in the lead-up.
Well, look, I can't be certain exactly what the settings will be in December. We could have a really accelerated pace of vaccination. But I wouldn't be planning a major event this year, no.
And just on that, obviously not asking you to speculate on what restrictions are going to look like after September 17, but a lot of Canberrans might point out that that's the day that school holidays begin. They might think, great, I can book a holiday to the South Coast.
Oh, okay.
Unwise decision?
Can I be very clear that I think every state and territory in Australia has closed its borders to the ACT, and that's not likely to change for this coming school holiday. So I think you can be much more confident about planning your summer holidays for December and January, but I don't think anyone will be open to us in 2 weeks' time. So I wouldn't be planning on going anywhere outside the ACT for the school holidays. I just don't think I don't want to shatter people's hopes, but I think it is highly, highly unlikely that any state will be open to us, or that you'd be going into a place that's got even more COVID than the ACT does at the moment. So I'd be thinking more about the summer holidays.
Sorry, Chief Minister, are you able to provide an update on the vaccination rates of those public villages that have been listed, as well as the disability sector, if you have those?
I don't have those stats in front of me. I know that first dose was higher than the ACT average in a number of those settings because teams had already been doing in-reach, but we'll get that data. A lot of it is Commonwealth Government data, so we'll need to get that off them. I think they update it every week, and we'd be due for some new data from them very soon.
Given the predictions about when the ACT and some other states will reach that 80% threshold and you want to go a lot higher, are you optimistic that there would be interstate travel by Christmas, or should Canberrans kind of avoid any areas with COVID even at those rates?
Look, by Christmas, I think everyone would want to be in a position where the nation was over 80% vaccinated. I can't speak for other jurisdictions in terms of what their border positions will be. The national plan is silent on state border restrictions, even at 80%. I put it this way, I think everyone would love to be able to have as much travel as possible safely for Christmas. But I don't think anyone wants their Christmas present to their family and friends to be a dose of COVID.
You mentioned about compliance with businesses, and given the minor easing of restrictions, how concerned are you about complacency?
That's why I've highlighted this today, that mask wearing in certain business settings based on the compliance activity and the lived experience on the ground is proving to be problematic in some businesses. 2/3 of those inspected yesterday, spot on, doing the right thing, taking it very seriously. So that's why we're highlighting it today. It's not just in a business setting though, it's broadly across the community. We talk a lot about common sense and all of this. Common sense isn't that common, it would appear, in some sections of the community. So let's go back to first principles. The purpose of a lockdown is to reduce the interaction between people. Wearing masks is a further protection against the spread of the virus, because there are always going to be circumstances where you are likely to come within close proximity of another person. But if both of you are wearing masks, that further reduces the risk. Another factor that further reduces the risk is if you are fully vaccinated. Now, at the moment, we've still got more than half of our 16+ population who are not effectively fully vaccinated. So another thing for people to think about in their activities and the context of a group of 5, and particularly the 5 singles who might want to catch up, think about your vaccination status as well. Less risk if you're all fully vaccinated. Still need to stay away from other people, still need to be wearing masks, because even fully vaccinated people can be carrying the virus. But a gathering of 5 unvaccinated people in a high-risk setting, no masks, all close together, all mingling, is about the riskiest thing you could do at the moment. So keep away from other people, wear your mask, and think about your vaccination status when thinking about who you might catch up with in your small group.
Some questions for the Health Minister, if my colleagues have any more questions for you.
One more for me.
Yeah. So just in your role as ACT Treasurer, have you had any indications about whether this lockdown is going to hit the ACT economy harder than last year's lockdown? And obviously the budget was supposed to be handed down yesterday. Will that now be significantly reworked in light of this 5-week shutdown?
Okay, so the second question, somewhat reworked in that we have announced a range of initiatives, including yesterday's, that if you do the quick maths on $20,000 per business and potentially 10,000 businesses applying, and a cost shared 50-50 with the Commonwealth, that's $100 million that the ACT budget will need to find. Now, not every business is going to claim the full 20,000. So it's going to be a little bit less than that, but that's one point. That would be a pretty significant standalone decision in an ACT budget. So reworked to that extent, yes. But we've been making budget decisions, and we normally would be up to about 2 to 3 weeks before actual budget day in terms of finalising things. So we are still doing that. And it's our intention in the budget to invest very heavily in health services, employing more healthcare professionals. We'll be focusing on funding the COVID vaccination program. We've got a massive business support package as well that's going to cost hundreds of millions of dollars. In terms of economic impact broadly, obviously the injection of funds by the ACT government and by the Commonwealth government through these schemes and through the COVID disaster payments, we'll see hundreds of millions of dollars flow into our economy at this time. It will depend on your point of measurement and what your presumptions are about how quickly the recovery will be once we hit the vaccination levels and the economy opens up more. The experience last year was that the recovery was incredibly strong, and so looking at the current fiscal year that we are in, we've started to encounter difficulties with the Sydney lockdown and then our own in July, August and coming into September now. So the first quarter of this fiscal year is going to be challenging, but there's every reason to think that the second half of this fiscal year, so the first half of 2022, will see an amazingly strong rebound. Canberrans have an extraordinary amount of disposable income on average. Not every Canberran, but on average, we're the highest income earners in Australia. So there's a lot of money being saved now by a section of the community that's going to be spent massively at Christmas and into 2022. So it's tough now, really tough now, but the future, based on last year and based on what's happened everywhere else, is that the rebound will be incredibly strong. There'll be a lot of pent-up demand. People will be desperate to go out to dinner, to go to the shops, to spend. There'll be big, big spending, but that's going to come around Christmas and into 2022.
On the other side of that, sorry, last question. On the other side of that, do you foresee a need for more income supplements or support from the federal government and social welfare supports as well as our lockdown continues and perhaps even past that September 17 deadline for vulnerable Canberrans?
Yeah, so important to secure, as we have, the additional Commonwealth COVID disaster payments through Services Australia that provide the tax-free $750 payment, as well as the $200 supplement for those who are on another form of Commonwealth payment who've lost, I think it's about 8 hours of work. So there is that additional support. The discussions on how that is tapered when restrictions are eased is an important one, because there will still be certain industry sectors that are going to be impacted beyond the point at which our lockdown ends and we can see more economic activity. The classic one being tourism and accommodation. There's not going to be travel really until December, I imagine, at the earliest. So there will be a need for ongoing support in that industry sector. Aviation will continue to need to be supported, and the Commonwealth have done various things there. Thinking locally again, hospitality, those sorts of areas that might have restricted or limited trading for a period will also need to be considered. So we would look to what we were able to successfully put in place last year as a guide to the sorts of measures that we would pursue. And the ACT, together with the other states and territories that are COVID impacted, will need transition support as we get to the point of the 80% double dose vaccination. That is, I think, going to occur, will occur with a really goodwill engagement between certainly my office and Treasurer Frydenberg's office. We've been able to work together very effectively on measures to support businesses and households in the ACT. And I want to thank Treasurer Frydenberg. I hope that we can continue our very productive working relationship. treasurers can work well together. Senators can sometimes get in the way of that. Terrific. Thank you very much.
For the Chief Health Officer or Health Minister? Doctor, on the Ansley Village cluster, how much of a risk does it pose to the wider community, particularly with that case that couldn't be tracked down for a period of time? Tell us on that.
Yeah, so it is, as we said, it's a very sensitive, vulnerable setting. It is likely, in terms of our interview with that case, that the majority of time was spent at Ansley Village. My input from the team today is that the majority of people that they're coming into contact with at Ansley Village, and they're doing that very regularly because they're delivering all their meals and their care, are very compliant, are very thankful for the help and support that they're receiving from government and community partners. And so, just with Condamine Village, we think with that wraparound support that we can really minimise that risk to the broader community. So at this stage, I'm really optimistic that the risk to the broader community is limited by the in-reach that is being available to those residents at the moment. We're doing another round of surveillance testing there at Ansley Village today. We did a round of testing at Condamine Court yesterday and there were no positive cases from that. So I'm optimistic.
Doctor, is the ACT's effective reproduction number still below 1? And are you seeing any trends in the figures, or are they still kind of jumping around a bit too much?
So in terms of the effective reproductive rate, that national report's only produced weekly, so we haven't seen that one for this week. I would suggest that it will be, most definitely, and that's again due to the overwhelming compliance with the lockdown measures by the ACT community. In terms of the trend in cases, our rolling 5-day average seems like we are heading in the right direction. So obviously numbers jump around on a day-to-day basis, but the rolling average seems to be going down. But as we said before, what's really of particular note is how many are in quarantine during their infectious period, and that has been up a little bit in the last couple of days. But again, the average would suggest that it's plateauing.
Doctor, on the new rules coming into effect, the Chief Minister spoke about how the outdoor factor is something that reconciles the difference between wanting people to stay at home and being able to meet some people outdoors. Tell us about how the virus works or is understood to work in outdoor settings. Is there concerns about large numbers of people gathering in outdoor areas, particularly high frequency or traffic exercise areas?
Yeah. Well, certainly there's concerns about large numbers of people gathering anywhere, indoors or outdoors. So that's why there's that cap on that number that can gather and recreate together. But we do know now over 18 months that outdoor congregation represents a much lower risk. The major, high-risk events that occur outdoors are sort of mass gatherings events, so outdoor music festivals or stadium events and the like, and we're certainly not thinking about reintroducing those quickly. But in terms of that low number of people that are known to one another, as long as people are abiding by common sense, mask wearing, good hand and respiratory hygiene, we think that's a really small concession that we can make to help people's mental health and wellbeing and not jeopardise the public health of the community.
There would be still an increased risk, though, if people are meeting with different people on consecutive days to go exercising, even if they are outdoors?
Yeah, I mean, I think it's, again, the questions that we're getting from Canberrans are indicating that they want to do the right thing. And, I think, again, as long as people abide by the cap on the number of people that can get together, that they're sensible about what they're doing, that they're following the public health advice, we do not think this presents a high risk.
Are you able to provide an update on that disability cluster. Has it grown, and how are people with COVID-19 with a disability receiving support?
Yeah, unfortunately I can't provide you with that update today because of the ICT issues that the ACT government has experienced, so we don't have that split today. We can definitely provide that tomorrow. In terms of how people with a disability are receiving support, we continue to have daily incident management team meetings with our public health medical officers, but also government and non-government partners to make sure that people that are particularly needing, whether they be cases or contacts, needing in-reach care are able to receive that safely. And so far we're really happy with how that's going.
Is anyone from that cluster one of those 13 hospitalisations?
I can't say that in terms of the active numbers. I know that we have had at least one from overall that's been hospitalised, but I'm not aware that they're still hospitalised. So I can't say from the current numbers.
What's our capacity to handle COVID-positive patients in hospital?
Yeah, the Minister for Health might want to say more about this. I know, speaking to the CEO of Canberra Health Services, that they've done so much planning around this over the last 18 months. They have dedicated COVID wards in both Calvary and TCH Public Hospital, and they're activating all their relevant plans. But I might leave the detail to the Minister for Health on that one.
Just on the cases, so today we saw, there's 9 under investigation, and if this follows like kind of a typical day, some of those will, a majority of those will probably be linked originally. Can you just explain, is it worrying if cases can't be linked straight away? And what can sometimes be that delay in terms of, linking those cases?
Yeah. No, it's not particularly worrying because it can take days, can take a long time. It can, some of that goes down to the whole genomic sequencing that we're trying to do on all of the cases, which can take a while to turn around, to link those chains of transmission. Sometimes it comes down to people remembering where they were or reviewing their bank records. Sometimes we even, with people's permission, are able to access their phone. So there's a whole wide variety of measures and investigative processes that we undertake to explore that. And those links can be made some days, even weeks down the track. So it's not particularly worrying. I think what's worrying is when some weeks down the track, and we've tried really hard, and we can't continue to link some of those mystery cases.
So sometimes it's just not as straightforward as, looking at the Check in Canberra app.
No, definitely not. And that's because either someone hasn't checked in, they forgot on that occasion. So it's we have to use a multitude of methods.
And just on that, you did provide an update on new cases linked to some of those exposure sites.
Yeah.
But would you mind providing just an update of the total cases linked to each of those 11 sites?
Sure.
Thank you.
So Bright Bees Early Learning Centre is 34, so that takes into account the 5 new cases. Ansley Village is 3, CIT Reed is 5, Gold Creek School 2, Downer Community Centre 13, Fiction Nightclub 51, Assembly The People's Pub 4, Lennox Jaguar Land Rover Dealership 20, Lynham High School 50 with 2 new cases today, Balconnen Basketball Stadium 7, Southern Cross Basketball 44 and Murchie Indian Restaurant 7 with 3 new cases today.
So questions for the Health Minister if we can.
Sure.
Minister, very high demand for the bookings for the 16 to 29-year-olds, so much so we heard that there was issues with the website this morning. Can you tell us about that?
So the issues with the website this morning weren't related to the level of demand. They were a broader issue right across the ACT ICT system that is being resolved over time. So I understand that as of just before we started the press conference, the health team has been able to now send all of the text messages to the around 30,000 people aged 16 to 29 who had registered through My DHR their interest in making a vaccination booking So about 16,000 of those went earlier this morning. Then there was that technical issue in relation to the whole ACT government that impacted the whole ACT government system, and then another 12,000 text messages have gone out. So hang on, that doesn't add up to 30,000, but nearly. So that's really great news. And as of, again, earlier this morning, 11 a.m, about 16,500 people had been able to get in contact and make bookings, and there were a few thousand people waiting for a call back. So I would encourage people, if you have to call the vaccination booking line, if you haven't pre-registered or for some reason your online booking isn't working, if you have to call the line, please do request a callback, but then be a little bit patient. They are now going to have thousands of callbacks to get through, but they will get to you.
Was it a power outage that occurred this morning, and has it impacted any other health services, particularly IT services like check-in monitoring?
That's my understanding. That it was a power outage, and I can't speak specifically to which services were affected.
And on the 16 to 29-year-old bookings, can you give us a bit of a date range for when these people can realistically expect to be able to start getting vaccinated?
Yes, so I understand that some people who booked in this morning were booking in for appointments in October. There'll be appointments right out through November. Some people may have been lucky enough to find an appointment in September. There have been new appointments opened up for later in September, but I imagine those would have been snapped up pretty quickly with the number of people that have come through.
Minister, there seemed to have been a bit of an issue with announcing that bookings were open for that cohort and then the invitation via text or email going out. Do you accept that that may have created some unnecessary frustration for people?
I'm sorry, I don't understand what issue you're talking about.
I guess the government made the announcement that bookings would be open several days before the text went out to people. So there's
no. I think you're talking about the Prime Minister made an announcement that in the Commonwealth program, 16 to 39-year-olds would be eligible, and that obviously opened up in relation to general practices who have Pfizer vaccinations. We've addressed this earlier in the week, that it is the ACT government that makes the decision about when bookings will be open for ACT government clinics, and what we had done was we had opened registrations for 16 to 29-year-olds some time ago, in order that when those bookings became available, when those appointments became available, it would be faster and easier for people to make those bookings for the actual appointments that were available. But that relied on us having our move to the AIS sorted out and ready to go so that we could identify those additional appointments, but also being sure about the supply of Pfizer that we were going to receive and the increase in supply so that we could actually open up real appointments for people that they could actually book. So we opened up that registration early so that people could get onto the system, and then today, this morning, we announced that bookings would be open. Now, I do recognise that the disconnect a little bit between the Commonwealth's announcement and the way that they made that and the process that we went through for our ACT government clinics may have caused confusion to people, but I don't think it was our announcement that caused that confusion.
Minister, are you able to provide an update on the capacity of our COVID wards, how many COVID positive patients we were able to house at the moment, as well as how many nurses we've been able to recruit through that drive to put back on the front lines?
Yes, so as we've talked about before, there's a scaled response right across the ACT public and private hospital system that the Clinical Health Emergency Coordination Centre has been planning for. I can't give you the specific numbers right across the ward system. Obviously, we have the capacity to scale up in response to the need that is there in the community. So today, 13 people with COVID-19 in our hospitals, 4 people receiving treatment in the intensive care unit, 1 that is ventilated. In terms of our ICU capacity that I was asked about yesterday, our current sort of standard capacity across public hospitals is 28 beds. And then our flex capacity and surge capacity, which start to incorporate that private hospital capacity as well as part of our planning, goes to 51 beds at flex and 110 beds at surge. And that really reflects the planning that was done last year to ensure that we could treble the number of ICU beds should they be required. Similar planning is in place in relation to emergency department and in relation to ward capacity. But obviously, if we get to that point, we will be stopping doing a whole range of other activities which currently see people in hospital for elective surgery, for example. So those beds wouldn't be required for that purpose and would be available for COVID-19. But of course, what we're aiming for is to not see that pressure on our hospital system because of the range of public health responses that we have in place, the test, trace, isolate and quarantine, the public health restrictions that we have in place, and of course the vaccination rate. And that is why it is so important that anyone who is eligible to get vaccinated does that as soon as possible, because that is ultimately what is going to reduce the impact on our health system when we do have to live with COVID.
An update on those nurse figures, if you have them?
I don't have a specific update. I know that those figures are coming down very, very quickly as many people are leaving quarantine, particularly those larger school groups that affected so many people across our community. You know, a couple of weeks ago, we probably had 10% of our entire community in quarantine or isolation as close or casual contacts or secondary contacts. Most of those people have obviously now come out of quarantine. So I don't have a specific number, but I can tell you it's a lot fewer than the 500 that we had a few days ago.
Sorry, no, the nursing number in terms of the recruitment.
Oh, sorry. No, I don't. I also don't have that figure for you. But again, I think it was well over the 150 mark in terms of people that had been brought on. It was clearly well over 500 people had expressed an interest, and the last I heard it was more than 150 people who had been processed through that process.
And if we manage to keep our cases down, the same with ICU and hospitalisations, given the strain that's expected on the New South Wales health system come October, will we be offering any beds in the ACT for critical patients in New South Wales?
Look, I think that's a really difficult question to answer in the sense of we are the regional hospital hub for our local southern New South Wales health region. And so it is standard that we would provide hospital care and particularly that tertiary acute hospital care for people from our surrounding region. But there is ongoing work between Southern Health District in particular, Southern New South Wales Health District and also Murrumbidgee Health District in relation to what those plans are. Again, our primary response is to keep those case numbers of people needing to be hospitalised as low as possible by absolutely getting our vaccination rate up. That is an absolute critical focus for us and should be for the community as well.
Given Year 11 and 12s are set to sit the AST on October 12 and 13, if they book with all the 16 and 29-year-olds today, they are probably not going to get into November. So is there any further plans to bring forward priority vaccinations for those age groups?
Yeah, so there is some consideration being given to whether we should seek to prioritise bookings for certain groups of people. Obviously, there are a lot of groups that are advocating in that space, including teachers, early childhood educators, Year 12 students and other people who deal with the public on a front line and are essential services like people who work in supermarkets. So we're working through all of that, but we are very conscious in doing that, that the standardisation test, the AST, is a critical point in time for our Year 12 students, and that is part of our consideration.
Questions for the Chief Police Officer, unless my colleagues have any more for you, Minister?
Yeah. Sorry, Emma.
Oh, no.
Oh, sorry. Also, Chief Police Officer. Thank you.
Chief Police Officer, border checks, compliance checks, and now also having to deal with protesters. How stretched are your resources at this point?
Look, I think everyone across the ACT bureaucracy, whether it be health, paramedics, fire or police, our resources are stretched, but we're maintaining good momentum. I've got some assistance from the national side of the AFP who have given us some resources. You know, this has been a marathon for us. We've planned for this. It's not as if we expected this to be a short-term thing. So, you know, people are looking forward to the end, obviously, as all of us are. But, you know, one of the things I'm really focused on is the health and welfare of my members, and it's something I'll continue to do so. But we're all in this together, and we'll continue to work towards the end.
Dealing with protesters, though, is it frustrating that it's perhaps counterproductive, a protest in this sort of situation?
Well, I think we want everyone to adhere to the health directions, and obviously that people, when they don't, not only does it put the community at risk, but obviously it also puts my members at risk. So, look, it does make me angry that people actually want to breach those laws by doing those protests. I mean, it is a democracy, you know, people can protest, but clearly in the current environment, any vaxxers and any face mask protesters is not appropriate, particularly when they don't come from Canberra. So I suppose my message is in the coming months, when we anticipate we'll probably see more of this, not just here in the Territory but across Australia, that don't come to Canberra. That's the message.
What's your message that you give to your officers about all these new rules that are coming into effect? We've heard a lot of confusion in the community about what they should and shouldn't be doing. What advice or what direction do you give to your officers when they're out doing these compliance checks?
Yeah, so we obviously do have people attached here in health, and we have officers who are working with health when the directions are drafted, so we actually have input in relation to that. We have a specific COVID task force where people are actually reading the direction, interpreting the direction, and then that is passed on to the members. So the information is being, on a daily basis, is being passed on to the members to ensure we're actually able to interpret what's been asked by the Chief Health Officer and adhering it. So the training is in place for our members. Yeah, and we have basically an on-call cell as well. So if people are confronted with a particular issue that they're a bit confused about, they can radio in and we give them a direct answer. So there is that ability for basically instantaneous responses to ensure people know how to actually adhere to the health direction.
What kind of policing activity can we expect to see on construction sites when the partial reopening starts? And given the scale of the industry, how regularly will ACT policing be able to check?
So it will be a team approach. It won't just be something that ACT policing does by itself. We'll work very closely with the Workplace Ombudsman and her team, and we'll work very closely with the team at Access Canberra. Look, they've been given some very strict guidelines and very strict rules, and I'm sure they'll comply with it. We are working obviously across with health as well as in relation to what's the appropriate penalty when people breach those particular guidelines. I think you'll find the larger firms will be visited quite regularly to ensure adherence because, you know, as the Chief Minister has said a number of times, where we have community getting together, it increases the risk of transmission. So we'll be, you know, as policing as much as we possibly can to ensure we don't see that we actually see people adhering to the guidelines and the rules.
So one more question for the Health Minister, if I could. Minister, are you able to give us any update on the vaccination rates for our essential workers, particularly those working in health and the aged care sector?
Yes, I certainly can in relation to both aged care and disability. So we just got new numbers today that 87.5% of ACT aged care workers have now had a first dose of vaccination and 54.3% a second dose of vaccination, which is absolutely fantastic. That means in the space of 3 weeks, we've almost doubled that first dose vaccination rate, which is absolutely fantastic. And of course, the mandatory requirement comes into place on the 17th of September. So we will continue that effort with the Commonwealth. In relation to NDIS screen staff, which is the information that the Commonwealth gives us as of the 27th of August, we're now looking at 58% first dose and 39.1% fully vaccinated. Obviously, that is a number that we want to get up for disability support workers, and we will continue to work with the sector and with those staff to do that. For residents in supported independent living, people with disability who are, of course, then extremely dependent on that support from workers, 73.8% have had a first dose and 66% have fully vaccinated, which is good, but again, we want to see that increase further so that all of those most vulnerable people in our community are protected. We've also been working very closely with the Commonwealth, with Capital Health Network and with directions to ensure that those people across our high-density social housing complexes and homeless people in Canberra can get access to vaccination. Directions has been doing a great job providing vaccination at a range of public housing sites and social housing sites across the territory, as well as doing pop-up mobile clinics, or rather mobile vaccination clinics for those people who are from public housing complexes or who are homeless in the community. And last week we negotiated with the Commonwealth to ensure that they could get double their Pfizer doses that they were expecting, so that they could bring forward that activity and ensure that those vulnerable people in our community had access to vaccination where they needed it. Great, thank you.